and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Mark Schreim. He's an otolaryngologist based in Boston, and he wrote the Kevin MD article, "Let's Not Let Our Pride Get in the Way of Heroism." Mark, welcome to the show.
Thanks for having me, Kevin.
So we'll get into your article in a bit, but first, tell me your story and your journey to where you are today.
Yeah, the story is fairly convoluted. So as you said, I'm an ENT by training. I did an ENT residency, did a couple of fellowships in microvascular surgery and surgical oncology, practiced for a couple of years full-time as an academic ENT here in Boston. And back in 2009, kind of started to switch my career. Went back to school, got an MPH, went back to school again in 2011 to get a PhD, and have really kind of moved out of full-time clinical work. And I primarily at this point work in the field of global surgery, which is the provision of surgery in resource-constrained settings. Most of my time now is spent either clinically in West Africa or here in education, training, and research around this issue.
So over the past few months, how has the pandemic affected you and your practice?
It's a great question. So the pandemic, at the start of the pandemic, Africa, the continent of Africa didn't have a lot of cases. And I was actually physically in Senegal, which is in West Africa when the pandemic started. And there was kind of this thought that, well, maybe you should just sort of stay where you are because Europe and the US is exploding and Senegal hadn't been at that point. We now know that was simply a delay and not necessarily that there was anything different. It's just now it's hitting Latin America and Africa. As somebody who works in global health, right? I mean, most of my time is spent on airplanes, and that obviously I haven't set foot in an airport since I came back from Senegal. That hasn't been the worst thing though. Like there's a lot to be done, a lot to be said for in-person interactions, especially if you're working cross-culturally. But a lot, obviously, as we've learned these last few months, can continue to happen, like this virtually.
All right. So you wrote the Kevin MD article back in April. Let's not let our pride get in the way of heroism. And I want to start by reading an excerpt. You write, "We desperately want to be a part of it. For most of us, this pandemic has tapped at a foundational altruistic urge to do our part. Our friends and loved ones are on the front lines, their faces creased by masks worn all day, their eyes bloodshot, their foreheads grooved by too tight goggles. Our friends and loved ones risk their lives while we don't." So I was wondering if you could share the story behind that article and why you decided to write it.
Yeah, this was written about a little bit less than a month into my return back to the US at the beginning of this pandemic. And, I am a sadly hyper-specialized surgeon that spends most of his time working in West Africa. There was precious little need for, any skills that I had, and appropriately so. And the last time I managed an event by myself was in residency. But we, so I'd be sitting there at home, basically with the hardest decision that I had to make of which couch cushion to be sitting on, while people that I knew and loved were out there literally risking their health and their lives, and it was eating at me. And I had a conversation with a friend of mine about the fact that, when things go south in the hospital, when we have to code a patient, there is this innate desire to go and help, to do something. However, often for most of us, the best thing that we can do in the middle of a code is to step back and to let the code team run it and not to kind of get in the way because it feels like we're doing something to get in the way. And that image had been bouncing around in my head that was exactly the same thing, except this time the code was a global pandemic. But sometimes the best thing for me to do, and I think it still continues today, the best thing for us to do really was to lock down, really was to get out of the way, really was to minimize the risk to our friends who are out there of overwhelming them, and get out of the way so they can do the things that they know how to do.
So I think what you describe is common for a lot of physicians. I'm in internal medicine, primary care, and a lot of the things I did was virtual and telemedicine, and I certainly wasn't on the front lines. So are there any tips that you could share from your experience that you could give to these clinicians who may not be on the front lines dealing with the pandemic?
Yes, I would say right now, as in the U.S., as we're sort of on the downslope of the pandemic, things are going to start getting back to normal. Most of us in public health very much expect that there will be a second and maybe a third and fourth waves of this pandemic, and whether or not they'll be bigger or smaller, more or less lethal, we don't really know yet. But as we prepare for the next wave, as we prepare for the fact that we're going to have to lock down again, we're probably going to have to stop elective surgeries and stop in-person visits. I think now's the time for us to consider the way we felt and acted the first time around, and kind of learn how to do it better, learn how to respond better for our friends that are on the front lines, for when it happens next.
So I want to ask about your global perspective. Can you give a prediction of the next 3 months of the pandemic? I know that it's hitting Latin America particularly hard. It's hitting India. So from your experience, what do you see the next few months to be from a global perspective?
So if you look globally at the numbers of daily cases, we have last 6 or 7 days now, the world has registered 100,000 cases per day or more. Our curve shot up, then kind of plateaued a little bit, and now it's shooting back up again. Now, for sure, some of that is increased testing. Some of that is just sort of increased availability of testing. But if you then start looking at a country level, as exactly you said, we're seeing these rises in Latin America, in India, in sub-Saharan Africa, and sadly, in places like Iran and Uzbekistan, who already had their first wave, they already came back down, and they're starting to come back up again. We are starting to see it here in certain states as well, that some states never plateaued, some states plateaued and are starting to come back up again. It's hard to say. Here's what I keep saying about this pandemic. We know how the virus behaves. Viruses behave the way that viruses behave. Like this, it's not the first time the world has faced a pandemic. What's hard to predict is how governments are going to respond to it, and how people within the governments are going to respond to the government's response. My sense is that worldwide, we're not done. We're not even done with the first wave yet, that it's going to go back up again. And my fear in a lot of the countries in which I work is that both treatment and testing are limited. In other words, we may never really know the full extent of this pandemic in certain countries in sub-Saharan Africa, because there's just simply no way to test for it, and also it's very difficult for patients to access whatever tests are available. So we may end up finding just sort of massive increases in mortality that are not necessarily attributed to anything, but are likely to be attributed to COVID-19.
Now, what should countries do? So we have two ends of a spectrum here, right? You have a more draconian approach that some of the Asian countries did, and you have a more laissez-faire approach like Sweden, and to a lesser extent what's happening here in the United States. So from a public health standpoint, what should countries do going forward?
The examples you gave are perfect, Kevin, because we also know the results of those approaches. We know that the quote-unquote draconian approaches like Taiwan did, like South Korea, like New Zealand did, have been immensely successful. And then we know that the more laissez-faire approaches like Sweden and in the US have not been. We know, for example, Sweden's a great example. The chief epidemiologist in Sweden just last week came out to say, I made a mistake. We should have locked down. And one of the things that's interesting about Sweden is that the whole argument against locking down is it'll impact our economy. We need to make sure that we keep our economy moving. Sweden's economy was impacted just as much as its neighbors, which locked down. So it had worse numbers in terms of deaths and not really much better numbers in terms of the economy. The public health person in me says, we've done this before. We've been here before. We've faced pandemics before. We know the response. The response is to distance. It is to test. It is to trace. It is to mask. It is to do all the things that we've been saying. It's just convincing people that it's more important to do that. It's more important to take care of your community than it is necessarily for you to immediately be out there back in your job.
Well, thank you so much, Mark, for sharing your insight. I do have one final question for you. And what's your take-home message for the Kevin MD audience?
These are complicated times. We haven't even addressed some of the things that are happening in the US right now around structural inequity as well. Like, these are very complicated times. And I think especially as medical practitioners and medical students and people in training, I think it's important for us to continually put a lens of health around the things that we say. We take oaths to improve the health of populations and of our patients. What are the best ways that we can respond with that lens of health in mind?
Well, thanks again for your time. Today on the show, we have Mark Schreim. He's an otolaryngologist. He wrote the Kevin MD article, Let's Not Let Our Pride Get in the Way of Heroism. Mark, thank you for joining me on the show.
Kevin, thanks for having me.